Good day everyone. So for this video, I'm going to discuss about the learners with difficulties with self-care. So self-care often refers to a person's capacity to perform daily living activities or specific to body care such as the following skills: washing ourselves, brushing teeth, combing, trimming nails, toileting, dressing, eating, drinking, and looking after one's health. Self-care skills are gradually learned by very young, typically developing children through adult modeling and direct instruction within developmental expectations. On the other hand, children with additional needs may struggle with the basic activities of daily living. Oftentimes, such students are those with moderate to severe cognitive deficit, including individuals with intellectual disability or intellectual development disorder or ID or IDD. So, what is intellectual disability? Intellectual disability is a developmental disorder that includes deficit in intellectual and adaptive functioning across domains of conceptual, social, and practical that occur during the developmental period. To be diagnosed with ID or IDD, a student must have deficit in both the cognitive and adaptive domains. Children with Down syndrome with moderate to severe disability may also have problems with self-care. For example, children with intellectual disability may sit up, crawl, or walk later than other children, learn to talk later, or have trouble speaking, find it hard to remember things. Young children suspected to have cognitive deficit which manifest as difficulties with self-care and be identified at a very young age. The traditional approach to measuring levels of severity of ID was determined through the use of intellectual tests. However, based on the definition provided by the American Psychiatric Association, using measures of intelligence is only one aspect as adaptive functioning also need to be assessed to identify if a child has an intellectual disability. In place of IQ level, the support needed by the person with ID is used to determine the level or degree of severity of the disability. Students who have difficulty with self-care oftentimes reach developmental milestones at a later age compared to typically developing peers. They learn to sit up, crawl, walk, and talk later than the other children and may have trouble remembering and understanding consequences of action. Due to cognitive difficulties, children with ID may also have deficit in the area of reasoning, planning, judgment, and abstract thinking. On the other hand, depending on the level of support needed, a student with ID learn adaptive skill at a slower pace, resulting in delay compared to the same age typically developing student. They benefit from modeling and can imitate well. Moreover, adults with mild intellectual disability eventually learn to be punctual and independent in society. Youth with intellectual disabilities are known to be friendly, sociable, and are reported to have positive coping skills. Using, using quantitative and qualitative measures, the study yielded by the following positive traits of the youth. 1. They have a positive outlook in life. Number 2, show positive relation with others. 3, have active coping skills. And 4, an acceptance coping skills. In the study, they found that the youth were rated highest in items pertaining to the positive outlook factor. This result suggests the importance of having to find the strength in children with additional needs, make them aware of this strength, and use them to their advantage.
Good day, I'm Brenda M. Sonoria, DEN2C, and this is the continuation of Ivy Larona's topic. It is General Educational Adaptations. Adaptations are changes in the way instruction and assessment are carried out to allow a learner equal opportunity to demonstrate mastery of concepts and achieve the desired learning outcomes. They are made to meet a student's need as identified on an individualized education plan. Specific approaches have been found to be effective in teaching students with difficulty with self-care, namely the use of direct or explicit instruction, task analysis, forward and backward chaining, as well as the use of video modeling. It is essential that the instructions given are simple and straightforward, and that hands-on experiential activities are used. The use of direct or explicit instruction. Explicit instruction is learning crystal clear. It gives learner a lot of opportunities to practice skills and get feedback. It can be especially helpful for learners who learn and think differently. For example, think about a time when you tried to follow a recipe only to find out that a step is missing or unclear. You may have been able to guess what to do next, but without explicit instructions, you may not have added the wrong ingredient or stopped cooking the dish altogether. The same thing can happen when learners learn something new. Some can make inferences to figure out the next steps or to work through the unknown. But for learners who learn and think differently, one unclear direction or having too many things to remember can be a deal breaker. That's where explicit instruction comes in. It can be used with learners of all ages, and it can be taught with a whole class, a small group of students, or as student at, or one student at a time. The second is task analysis. Task analysis is a behavioral approach that breaks down a complex behavior or task into step-by-step procedures, thereby providing modeling and ample practice for the student with difficulties. Gargiulo 2012 provided working guidelines on how to do task analysis. First one is define the target behavior or task. The second is identify the necessary needed skills to successfully complete the task. 3. Identify the necessary materials to perform the task. 4. Observe unable and competent to perform the task. 5. List the needed steps in sequential order to complete the task. In an inclusive classroom, self-care skills such as washing hands and brushing teeth can be task analyzed into the simplest steps and presented on a poster accompanied by pictures. Using direct instructions, the teachers models how each step is done, then allows the students to try the steps with guidance and prompts until he or she is able to do the task independently. Hence, direct instructions and support from the environment in the form of prompts and as well as routines that are simplified are essential for students to eventually become independent in using self-care skills. Hayward 2013. Next is forward and backward chaining. Forward chaining is the logical process of inferring unknown truths from known data and moving forward using determined conditions and rules to find a solution. While backward chaining Start by breaking the task down into small steps. You teach your child the last step first, working backwards from the goal. You complete all the steps except the last one. You get your child to practice the final step.